Good morning and welcome to the viewing and listening audience to this, the 10th meeting of the Joint Select Committee on Social Services and Public Administration. This is the committee's first hearing with stakeholders pursuant to its inquiry into the mental health and psychosocial services available to the population during the COVID-19 pandemic, with a specific focus on measures to curb substance abuse and suicide. Members of the public are invited to submit your comments and questions via the Parliament's social media platforms, YouTube channel ParlView, and via the Parliament's Facebook and Twitter feeds. Before us today are three entities: the Ministry of Health, the Ministry of Education, and the Ministry of Social Development and Family Services. I'm the committee's chairman, Paul Richards. At this time, I'd like the committee members who are present to please introduce yourselves, starting with Member Mohit.
Good morning, Chairman. Member for Chaguanas East. Thank you for the opportunity and welcome to all members present here today. Good morning.
Thank you, Member Singh.
Thank you, Mr. Chairman, and good morning to all colleagues present. Good morning to the members who would be in this session. Avinash Singh, member.
And Member Nakid.
Good morning to all, and really nice to have all of you here. Looking forward to a productive session.
Thank you very much. Our member Rohan Sinha was with us earlier, but he had a conflicting engagement and had to excuse himself. Other members of the committee include Member Esmond Ford, Member Penelope Beckles, and Member Roger Monroe, all of whom have conflicting engagements today. Our inquiry objectives are the following. There are four objectives in this inquiry. One, to undertake a preliminary examination of the trends in mental health and mental illness during the COVID-19 pandemic. Two, to evaluate the efficacy of the support systems and services of the state aimed at counteracting the adverse effects of the COVID-19 pandemic on mental health and wellness in the population. Three, to evaluate the adequacy of support systems and services available for persons in the areas of substance abuse and suicide prevention. And four, to evaluate the mental health support provided to healthcare workers providing treatment for COVID-19 patients. At this time, I will invite members of the entities before us to introduce themselves, starting with the Deputy Permanent Secretary of the Ministry of Health, Ms. Melanie Noel.
Hello, good morning, Chair and committee. My name is Melanie Noel. I'll have the other members of my team introduce themselves.
Good morning. I am Dr. Hazel Othello, Director of Mental Health in the Ministry of Health.
Good morning. I am Leroy Thompson Hollingsworth, Coordinator of the National Alcohol and Drug Abuse Prevention Program, NADAP.
Good morning. I am Keisha Lewis. I'm the General Manager of Mental Health Services at the Northwest Region.
And that's the Ministry of Health, right? Thank you. Next, we invite the Chief Education Officer Acting, Mrs. Lisa Henry David.
Good morning. I am Lisa Henry David, Acting Chief Education Officer, Ministry of Education. And my other team members are Ms. Natalie Robinson-Arnold, Social Work Specialist, and Ms. Irma Bailey-Reyes. I will ask them to come in and say good morning.
Pleasant good morning, everyone. Good morning, Chair. I'm Natalie Robinson-Arnold, Social Work Specialist, Student Support Services Division.
Good morning, everyone. Good morning, Chair. I am Irma Bailey-Reyes, Interim Supervisor of the Developmental Assessment and Intervention Unit, Student Support Services Division.
Thank you. And now on to the officials of the Ministry of Social Development and Family Services, starting with PS, Ms. Sheila Cicheran.
Hi, morning all. I am Sheila Cicheran, Acting Permanent Secretary, Ministry of Social Development and Family Services. My other members, colleagues will introduce themselves.
Good morning, Chair. Good morning, everyone. I'm Lorraine Reyes-Farrell, Executive Director of the Social Displacement Unit.
morning, Chair and other colleagues. I am Kathleen Sarker, Assistant Director, National Family Services Division.
Good morning, Chair and everyone. I am Lisa Eichel, Acting Director, Social Planning and Research.
Thank you all. Thank you all for being with us. I'd like to remind you, both committee members and officials, to direct your questions and concerns and interventions through me, the chair. We'd also like to remind members to kindly activate your microphones on your devices when you are acknowledged by the chair, and to turn them off when you've concluded your contribution in that round. And of course, we will now proceed. Just to give you some background of the issues facing us, and some background information is provided by the Ministry of Health. In terms of mental illness in Trinidad Tobago is the third highest in the Caribbean with respect to the prevalence of mental illness with schizophrenia, mood disorders, and mental and behavioral disorders and substance abuse. 20% of TNT's population may be living with some type of mental illness, which can be treated but is not currently being treated. This according to information provided by the MOH. In terms of depression represents 13.2% burden of disease in TNT, accounting for 3.35 in the region, dailies in the region, and constituting the greatest percentage of total disability. It ranks fourth when compared to all causes of disability in TNT. In 1998, the incidence of depression was found to be 5.22 per 10,000. It is estimated that globally there has been a 50% increase in the number of persons living with depression and or anxiety between 1990 and 2013. In terms of suicide and self-harm, it accounts for 2.1% of total disability in TNT and ranks 7th highest rate of suicide in the region per capita and the 3rd highest in the English-speaking Caribbean, with a rate of suicide in 2017 recorded at 13.6 per 100,000, whilst the regional average was 9.8 per 100,000, which means we're ahead of the regional average. In 2010, there were 12.2 deaths per 100,000, 4.6 in women and 19.6 in men, rising to 14.5 in 2015. Mortality from suicide continues to be higher in men than women. However, according to this information, women report more suicides attempt. What is even more startling is students aged 13 to 15 surveyed in 2011 reported that 17% of them seriously considered attempting suicide in the past 12 months when the scan was taken, while 14.4 actually attempted suicide one or more times during the same period. In 2015, suicide was reported to be the second leading cause of premature death in adolescents ages 15 to 29 globally. So that's really striking information. In terms of alcohol and substance abuse accounts for 1.2% in total disability in our country and 6.9 burden of disease in Latin America and the Caribbean. The recorded consumption of alcohol and liters per alcohol per capita increased from 5.8 in 2003 to 6.4 in 2010 and 7.9 in 2016. In a recent survey, 86.5% of students surveyed reported they had their first drink of alcohol before the age of 14. And 23.8% reported drinking so much they were really drunk, in their own words, one or more times during their lives. The use of alcohol and substances before the age of 14 is associated with an increased risk of developing alcohol substance abuse disorder in adulthood. And just to identify, we're dealing with very sensitive topics here, and we have all seen what's in the news media recently in terms of the tragic reports, the reports of tragic suicide. So we are going to try to be as sensitive as possible because this is being broadcast, and we know that there are vulnerable populations and persons looking on. In terms of deaths by suicide, in 2019, there were 92 reported suicides, 79 men and 13 women. In 2020, it went up to 104, comprising 83 male and 21 females. And in 2021, it went up to 128, which included 110 male and 18 females. So we see that there's an increasing trend upward, and part of the responsibility of this committee, or the objective of this committee, is one, to dig deep with our stakeholders and find out what is happening that's causing this increase and what systems are in place, how effective those systems are, and also what we can do to close possible gaps. At this time, I'd like to invite the heads of the committees before us to present opening remarks, starting with the Deputy Permanent Secretary in the Ministry of Health.
Thank you. Good morning, Mr. Chairman, members of the Joint Select Committee, members of the Ministries of Social Development and Family Services and Education, fellow colleagues of the Ministry of Health, and our viewing public. I take this opportunity to reaffirm the commitment of the Ministry of Health in the provision of mental health services, especially during this COVID-19 pandemic, for our dedicated and ever committed healthcare workers and our citizens. From the onset, the ministry has collaborated with several ministries and organizations. This resulted in the design, execution, and coordination of a vast range of mental health and psychosocial support programs during the pandemic. Programs that focus on mental health awareness, stress management, mental health in the workplace, employee health and wellness, psychological first aid, suicide awareness, healthy lifestyle, healthy me, healthy you, post-disaster mental health, public education, and management of loss and bereavement. Further, several modes of training and communication were utilized to allow health workers and other citizens to benefit from the array of mental health services, from virtual training and consultation sessions involving health workers, individuals, and groups, the promotion of the utilization of EAP services, and telemental and in-person mental health services for health workers, individuals, and groups. In this regard, it is envisaged that today's proceedings will be insightful towards enhancing the programs and services for mental health care during and after the pandemic. Thank you, Mr. Chairman.
Thank you so much. Can we go now to the Acting Chief Education Officer, Mrs. Henry David?
Good morning, Mr. Chairman. Mr. Chairman, members of the committee, representatives of the Ministries of Health and Social Development, other members of the Ministry of Education team, members of the viewing public. The Ministry of Education is committed to the children of Trinidad and Tobago and ensuring that they are provided with educative services. In this regard, we will continue working with parents, other ministries, and stakeholders to ensure that our students benefit from all necessary services, inclusive of hotline services, therapeutic support, psychoeducational services, and psychotherapeutic services. We will continue to work with our colleagues to ensure that our children benefit from the necessary services.
Thank you so much. And we go now to the Acting PS in the Ministry of Social Development and Family Services, Ms. Sheila Cicheran.
Good morning, Chair and members of the committee, colleagues of the other ministries, and my fellow colleagues here at the Ministry of Social Development and Family Services. The Ministry of Social Development and Family Services welcomes the opportunity to meet and discuss with the Joint Select Committee the important issue of mental health. Given the recent spate of suicides in the midst of this COVID-19 pandemic, today's presentation will focus on some interventions, strategies, and psychosocial support initiatives being implemented by the ministry as part of its efforts in treating with the critical issue at hand. As you are aware, the Ministry of Social Development and Family Services is mandated with the responsibility for addressing the social challenges of poverty, social inequality, and social exclusion. As a result, particular emphasis is placed on developing and executing programs and services, including psychosocial support to protect and assist those who are classified as vulnerable, as well as marginalized groups such as persons with disabilities, the elderly, the poor and indigent, socially displaced persons, families and persons living with HIV/AIDS, as well as at-risk youths. Guided by the tenets helping, empowering, and transforming lives, the ministry remains cognizant that mental health and psychosocial support services are essential for individuals to maintain a state of well-being in which they realize their own abilities to cope with the normal stresses of life, can work productively and fruitfully, and are able to contribute to their communities. To this end, the ministry looks forward to today's stimulating discourse on this important global and major problem of mental health. Thank you.
Thank you very much. Thank you to all of you for being here again. The approach we're taking this morning is our three committee members will be interfacing at the start with each of the entities before us, the Ministry of Health, the Ministry of Education, and the Ministry of Social Development and Family Services. After which, that first 15-minute round, the other members of the committee will join in to ask the questions that they think are material, and we'll have a discussion on a particular issue so as to engage all our stakeholders effectively this morning. Before I pass on to my colleague, Member Naked, let me just ask the Ministry of Health to start by giving us, from what you've seen, and I know the inquiry is really focused on what has transpired in terms of mental health in relation to suicides and substance abuse during the pandemic. But of course, we're seeing the trends, and the trends are not dissimilar to what has happened before. One, in terms of males being more susceptible to suicide than females. And two, from my memory and research, males having a tendency also to be susceptible to substance abuse more than females, generally in the population, even before the pandemic. So the question to start is, has the pandemic exacerbated that paradigm? And what are the trends that you'd seen before in terms of why you think males are significantly more predisposed to attempting and unfortunately committing suicide than females in society, in our country?
Okay, good morning to the chair and committee. What the research has shown and what continues to be a trend is that males are more likely to complete the act of suicide, and therefore suicide statistics tend to consistently show higher numbers of males. However, when you look at the entire spectrum of what we call suicide behavior, and you look at the non-suicidal self-harms, and as well as incomplete suicides, in other words, suicide attempts that did not end someone's life, then you see a higher prevalence of females. So that the statistic for males really refers to completed suicides.
What were the main drivers during the pandemic?
During the pandemic, we have not seen any changes in those trends. Those trends remain consistent. While the absolute number of completed suicides has increased over the last 2 years, the actual trends have not changed.
Has the ministry been able to ascertain what the factors have been underlying the recent high-profile situation? Seem to be economic challenges. Are there other factors that the ministry has been able to identify in terms of these suicides in the country?
One of the difficulties with suicide is that we're never absolutely sure of the cause, because of course the person whose story is being told is no longer with us. However, circumstances, information from relatives, information from friends or loved ones may give us some information, as well as sometimes people leave notes. We get the suicide statistics that we provided were received from the Trinidad and Tobago Police Service, and their data shows a large number of suspected reasons or contributing factors towards these suicides. And they include financial challenges, they include social problems, interpersonal conflict, relationship breakdown, substance use related conditions. Of course, quite a few are associated with a previous history of mental illness, particularly a previous history of depression. So it's really multifactorial.
Thank you. Member Naked, go ahead, please.
Good morning to all of you. Thanks for being here. First of all, I'd like to thank all of you for some of the information sent. I only got it very recently. So I would like to go off a bit off of the script that has been sent. And I've gotten permission to do so by the chair. And my first question would be this, the obvious question. I'm looking at some of the numbers, and I saw that the numbers for in the last 3 years here, as reported, were in the last 2 years, sorry, this will be 2021, were over 300 suicides. Is that correct? As reported in the newspapers.
The data that we have for 2021 is 128. That's the most recent data that we have.
So are you aware that in the media it was reported in the last 2 years was over 300? So that's what I'm asking. Are you aware of that report?
I'm not aware of that.
Okay. Are you also? First of all, I'd like to state I have a sister very much into the psychology and psychiatry, plus 2 sons studying it. So I'm a bit around with a lot of things. And one of the concerns that I had, and Chair will know this, that came to Parliament, is that the lack of clinical psychologists as it relates specifically to kids, to children, in dealing with children. Do you have any numbers of how many, for children, pediatric care, clinical psychologists we have in Trinidad and Tobago to deal with mental health for children?
I don't have that number in front of me, but what I can say is that some of our services for children are provided by general trained psychologists, so they may not be specifically subspecialized child psychologists, because those are hard to come by. They're just generally hard to come by. Very often when persons train in those areas, they do not return to the Caribbean because, the aspirations in first world countries are quite attractive. And if they do return to Trinidad and Tobago, they're under no compulsion to return to the public service. They can provide their services in the private sector if they so wish, so that the numbers of specifically trained child psychologists in the public services have traditionally been low.
I thank you. That was very on point, and it's exactly what I thought as well. Which brings me to the same question. You've stated here that men are seen here that men commit the most suicides, which I also feel is the situation. But we have a lot of suggestions to deal with the symptoms of mental health and all of those. What is the situation with the Ministry of Health to deal with the causes, the root causes? Because I have a study here that was done in the Scandinavian countries, Denmark and Norway, which basically relates most mental health issues to economic issues of the home, domestic issues. Now, I know there may be anomalies. Somebody might not like, he didn't have, for example, in a first world country, he didn't like a bike path to ride his bike, or a path to go in the mountain. I'm not speaking about those anomalies or those, and these are not questions meant to put you all on the spot. I'm just asking, what kind of cooperation between you fine ladies and the ministry is responsible for economic policies that can really root out the causes, the root cause of our mental health. Because anyone can go through Port of Spain and different boroughs, and you see our bus stops have turned into halfway homes. We have homeless. So I want to also include the homeless in that as well. As have their studies been made, how many of those homeless people, how many of them have mental health issues? Are we keeping a record of them as far as their mental health issues are concerned? And all of these things. I mean, it's a broader ambit than what I've seen so far in what has been submitted. So that's why I'm not sticking to the script. And I would like to know, are we going to get finally, ladies, to the root causes? And this is not, I know this is not your fault. It's not a blame. I'm asking, has there been any attempt to cooperate with the ministries that will determine how the economic situation in the homes affect men more, who bear the responsibility most times, whether it's good or bad, for feeding their children, for watching their children go hungry and suffering from that, which will lead, of course, to alcoholism, drug abuse, all of that we know, correct?
Through the chair, the social determinants of health, and in particular the social determinants of mental health, are well known and documented, and they're always a cause for concern, so that the Ministry of Health collaborates with all ministries as opportunities present themselves, and sometimes as opportunities are created, so that we can best serve the population of Trinidad and Tobago. With respect to the specific issues, raised, we are mindful of the fact that even though a number of factors may contribute towards impaired mental health, or in the worst case scenarios, suicide, that is usually a balancing act between people's adversities and their coping skills and other protective factors. So what we seek to do at the Ministry of Health, we can't control the adversities, but we can strengthen the coping skills, and we can help people to strengthen the protective factors.
But if I could, Dr. Othello, sorry to interrupt you, but following from the question from Member Naked, I think, and he can correct me if I'm wrong, what he's trying to get at is we have the data showing upward trends in suicides, significantly more for men. And if they're given the trends that are clear and even predating the pandemic, are there mechanisms in place, even though there may not be more economic resources, to identify the vulnerable groups or persons who may be going through the challenges, to intervene through the Ministry of Social Development or the Ministry of whatever, so that we can reverse the trends? I think that is where Member Naked was aiming his question, in terms of us being responsive and proactive, given the data we're seeing.
That's it exactly, Chairman. So the question, the question basically is, we cannot keep on treating with the symptoms. We have at some point in time to direct our actions towards the causes of those systems. And the good lady said that there has been some cooperation, but I haven't seen any data presented to see where we have reached as far as that cooperation is concerned between the Ministry of Health and, for example, the Ministry of Social Development, as you have said. Is there any data to see what is the cooperation in order to reverse that trend of those causes being done? Has more been given? Has training been done more in order to incorporate people who are on the verge of suicidal thoughts, and so being employed, improving their economic situation in order not to feel that burden, that sense of for want of a better word, that sense of impotency, and then taking care of their families, their children, and therefore they have suicidal thoughts, they're driven to alcoholism, substance abuse. Do you see where I'm going, ladies?
If I understand the question that's being put to us, Those issues are currently being addressed through the technical working group of our mental health and psychosocial support system. That is a system that brings together multiple agencies, several ministries, several non-governmental organizations, several other private providers of mental health services, as well as regional organizations, and harnesses all these organizations' skill sets and resources to meet the needs that were mentioned. As a result of—
Well, can you be specific? What are the kinds of programs that the technical group is working on? Because I understand the general framework approach, but I think what the member is asking is what specifically is being done and what is needed to support the success or the failure of what is being done.
Right. Okay, so some of the things that are being provided, if I may find my document, because one of the most actively used resources is the access to helplines, and we have amplified that and made it more visible through the findcareTT.com website so that people could find those resources more easily. Basically, we provide services on several levels. So at the most basic levels, our stakeholders provide a wide range of social services in terms of, for instance, during the pandemic, they provided hygiene kits, they did food distribution, they did a lot of communication, they did social media posts and brochures providing people with essential information.
Excuse me, can we stick up, and Chairman, sorry, I'm sorry to interject on the—
Go ahead, please, yes.
But since we have reached to the point of the cause, of addressing the causes, I think that is where you've taken the conversation, the dialogue. I want to get specific. I mean, all the general framework as you are stating now, it's all well and good. But let me give you a specific example that relates to places of concern where I am concerned about. For example, I have gone through the East-West corridor, and I have yet to see, for example, an ad advertising alcohol in Bayshore, Goodwood, Glencoe, Victoria Gardens, but I can go through Tinapuna, St. Joseph, Mongol, Sandy Gandhi, Mova, Lavantil, and I see a multiple of ads for alcohol. Alcoholism, as we know, is one of the reasons that we are here speaking about this subject. I want to know, you spoke about that cooperation. Has there been some cooperation between your ministry and the government in order to not have these ads placed where kids see them every day, where their fathers see them every day, the most disadvantaged, the most vulnerable? Has there been some cooperation in order to stop these ads being placed in certain communities in Trinidad and Tobago? To you, please.
Manaki, I think you're asking Dr. Ostella a policy question that she is incapable of answering. And your question has to do with whether or not there's a structure in place to deal with advertising for alcohol where children can view these advertisements.
Not only children, Chair.
Well, the general public, that question is beyond the remit of Dr. Othello.
Well, I'm speaking about, she said that there's cooperation between our ministry. I'm giving a specific example of what can address the actual causes of mental health, Chair. I'm asking, and if she has no answer, it's not any blame game here. If she has no answer, then maybe she can say, well, we'll take that under advisement and we will see what we can do, because alcoholism, as they mentioned, you mentioned, and what is stated, is a serious issue with mental health in Trinidad and Tobago. It serves as an escape temporary, but it does unbelievable damage, and especially in vulnerable communities, which should be our area of concern. I'm just making the point that it's obvious to all and sundry that these ads are placed in certain vulnerable communities, whereby they are not placed in other communities. Clearly so. So my question, it's not about blaming anybody. It's just about, it's an obvious cause of distress among vulnerable sections of the society, and what can be done, Chair. I mean, it's definitely should be under the remit.
Dr. Osella, do you think there's a suggestion that you can have from where you sit in terms of that sort of paradigm, where exposure to the advertisements may be driving the abuse? And I think that's what Member Anakit is asking.
Good morning, Chair. Good morning, everyone. Lara Thompson, Hollingsworth, Coordinator of NADA. The question of advertising, as you correctly stated, Chair, is a matter for policy change and possibly legislative change. However, our division we have been actively engaged in prevention work, particularly during the COVID period, for vulnerable groups such as children, preschoolers, the teachers, student support services, and so on of the Ministry of Education. We've engaged in a lot of partnerships in addressing substance use and preventing early onset of substance use among children, so that the likelihood of them progressing to a substance use disorder later on in adulthood is minimized. Thank you.
Would you be able to give us a sense of the measurement of those programs and the number of ads you have out trying to deal with the issue of substance abuse before it takes foot? Can you give us that sort of data? How many ads, where the ads are placed, if the ads are on social media, the effect of the ads, the interaction with the target audience?
Yes, Chair. The ads are placed on social media through the Ministry of Health's Facebook page, Instagram page, and so on. We've also hosted webinars during the...
Can I ask you a question?
Sure, Chair.
How many 14-year-olds do you know are going to the Ministry of Health Facebook page?
The 14-year-olds may not go to the Facebook page, but their caregivers and certainly a lot of stakeholders who interface with 14-year-olds will give them the opportunity to participate. And because we take a very strategic and trainee-trainer approach, the division of NADAP has been currently engaged in addressing key stakeholders and gatekeepers in order to deal with training persons in the area of substance use, so those persons who are well placed, who interface with young persons, are in a better position to transfer the information.
Ramana, could you have 2 more minutes?
Yes, I have one more question, and I thank you for your interventions, Chair. I think it's not about, I would like to, again, reaffirm to these fine ladies that it's not about blaming anyone, it's about trying to find solutions. So I hope that they take my line of questioning in the spirit that is intended. Now, my final question is this. Since we are focused on the causes rather than the symptoms, this is where the dialogue has taken us. Has there been any cooperation between your ministry and, for example, the Ministry of Education when it comes to the kids who have fallen out of the system? Has there been any data to see the kids, for example, who had no access to laptops, who were not online, who were unable to get online, which we know to be in the thousands? Has there been any data gathered at all to see how they were dealt with? What was the solution? And this goes to the point. Maybe if they were given laptops, these kids, some of them, well, a lot of them would not fall out of the system. I think that is clear. I think it's not easy. I know from my own kids who look at their colleagues and their colleagues have a laptop. Maybe it's the newest laptop, and they also want that. So you can imagine the kids who would not have a laptop and at all and have no access to be online. Has there been any data gathered to see what was the mental health situation of those kids since we have gone down that road here in the dialogue? Has there been any attempt by your ministry to have some kind of dialogue with or rapport with the Ministry of Education to fix that particular problem? concerning the children of Trinidad and Tobago?
The Ministry of Health has collaborated with the Ministry of Education from the beginning of the pandemic, from the time we set up our MHPSS technical working group. However, the specific interventions for children are provided by the Direct Division of Schools, the Student Support Division of the Ministry of Education, and we collaborate with them as needed. I think the questions that you're asking, the responses can be provided by the Ministry of Education.
And there would be data as related to that? There would be data gathered since you said you cooperated with them?
Some the questions that were asked by the committee on the subject of services provided to children, the Ministry of Education would have that data.
I thank you very much.
Thank you. The first member Mohit and member Singh, if you have questions to the Ministry of Health officials, please go ahead. While they're coming, Dr. Ocello and team, you indicated that the data provided here was provided by the Trinidad and Tobago Police Service. So they're the ones who would have to interface, I guess, with the families of the persons who would have committed suicide. Does the ministry do debriefing to its mental health division of the families, in addition to the information got by the, obtained by the TT Police Service, to see what the antecedents were to this person attempting or committing suicide, and what the mental state of the other family members are, to ascertain if the circumstances can contribute to other issues in the family? Is that sort of debriefing done?
The Ministry of Health does not provide actual services to the public. That is provided by the Regional Health Authority mental health teams, and they have their doctors and social workers and psychologists and mental health nurses are the ones who interface with the public and provide the care and treatment needed to suicide survivors. I want to respectfully introduce one point of clarity, if I may.
Please do.
Please, Chair. I want to please urge us to refrain from using the term committed suicide. It is no longer the preferred term, because when we say committed suicide, it sounds like committed adultery, committed murder. It sounds like something criminal. So we now talk about people dying by suicide or lives being lost due to suicide, but we no longer use the term committed suicide.
I appreciate the correction and I understand the sensitivity. Thank you so much for that. In terms of those regional cooperation divisions that you spoke about, who are, or the regional offices that are dealing with the persons who may have died by suicide, who would have died by suicide, do you have a coordination or information gathering mechanism with them, since they are actually interfacing with the persons in communities, so that that data, in addition to the data that you get from the TTPS, can be used by the Ministry of Health for analysis and intervention mechanisms?
One of the things that the Ministry of Health is right now actively engaged in is the setting up of a suicide surveillance system, which will provide precisely that data. We're in the relatively early stages of that endeavor. We have met with the Regional Health Authority persons who, the staff members who are involved in data collection. And in doing so, we found out that different bits of the data is collected in different ways at different centers. So we're coordinating that so that everybody is collecting the same data, so that that data can be compiled in a systematic manner, so that in the very near future, we will be able to have a more systematic approach to that data collection. And that data will be able to be disaggregated in ways that can point to the specifics that we need in order to know where to put resources and how best to provide services.
Any questions from members Singh and Mohit for the Ministry of Health? I have a question based on the data provided through you by the TTPS, and I'm seeing some trends here where the larger numbers are jumping out in the 25 to 29-year-old category, the 45 to 49-year-old category, and the 60-plus category, particularly in males. I don't know if you've been able to identify those trends. Is there analysis done on that, or what may be the underlying factors that may be driving those trends? Because when you see 60 plus, in 2019, there were 10, which is about the highest two numbers. There's 45 to 11, 45 to 49, sorry, 11, and 25 to 29, 10. Similarly, in 2020, 60 plus is 18, the highest number. And in 2021, we see 30 to 34 and 35 to 39 being 17 and 18 respectively. And again, 60 plus, 14 plus. So there seems to be a trend in persons over 60 maybe encountering some sort of challenge in their lives that may be one of the underlying factors that is driving this phenomenon. I don't know if you saw those trends in terms of the data disaggregation.
Well, we looked at the trends, but we're only in March of 2022, and this is 2021 data. So there hasn't been time for any, the kind of analysis that would enable us to know what is driving those trends as yet. But what I can say though is that the high prevalence of suicide within that young adult and working age adult age group is not uncommon in terms of statistics that you would find from pretty much any country.
Do you have any data on the numbers of calls to helplines or other facilities where persons are reaching out for help and there may have been successful intervention in that regard, and have those numbers increased during the COVID-19 pandemic? I think the anecdotal evidence is suggesting that it has increased, because the student support services would have told us in our interface with them in a different inquiry that those numbers to student support services have increased. Have other numbers like Lifeline, etc., agencies, I'm sorry, would they have reported increased volumes to those agencies?
Yes, they have.
Do you have the data you could share with us?
I don't have numbers in terms of agencies like Lifeline at my fingertips, but it can be requested.
Can you supply that to the committee in writing, please? I'd appreciate that very much.
That can be provided.
Thank you so much. Thank you for your candor. We're going now to the Ministry of Education. Member Singh, the floor is yours.
Mr. Chairman.
Oh, go ahead, Member Mohit. Sorry about that. Go ahead.
Mr. Chairman, before we move on, can I just have some information in terms of the succession of cases that may have been brought to the attention of the ministry? And in addition to that, how has the liaison and follow-up mechanisms been with the Ministry of Social Development, etc., and the different agencies required to deal with these cases?
Individual cases are not brought to the specific attention of the ministry. As I explained before, the individual cases are dealt with on the ground by the healthcare providers in the communities. And that is something that's very important to mental health, that it is provided at the community level where people live and function. But in terms of collaboration, that is the very reason why the mental health and psychosocial support network was set up, to facilitate collaboration, and not just collaboration, but coordination, so that we know who is doing what, where they're doing it, when they're doing it, what services are being provided, what target groups these services are provided to. And through that, we were able to determine what gaps existed in terms of service special groups, and find out what services can be provided to those groups, so that throughout the course of the last 2 years, we have placed a lot of attention through that coordinating mechanism on making sure that services are provided as far as possible where they're needed.
Mrs. Thompson Hollingsworth, just before I go to Member Singh for the Ministry of Education, has NADA been able to identify an increase in clientele seeking your intervention during the pandemic?
Chair, in our interaction with the providers of treatment services, they have indicated that a few of them have indicated that they saw an increase in the request for services. But in terms of the work that we do at NADAP, it is focused on policy development, on prevention initiatives, and sharing prevention initiatives with others and engagement with other stakeholders in carrying on the prevention work. The treatment work is actually done by other providers, including the RHAs, as well as other NGOs.
And have these groups been able to say if the clientele demographic is veering downward in terms of the persons coming for intervention? Because the information I would have relayed earlier on indicated that younger and younger people, teenagers, are becoming more involved with alcohol abuse from an even younger age in larger numbers.
The COVID pandemic period provided some challenges in data collection. However, we are currently engaged in getting that data for 2021 and 2020 and going forward and improving the monitoring and evaluation mechanisms in collecting that very data.
Thank you. Thank you so much. Member Singh, Ministry of Education officials are in your hands.
Thank you, Mr. Chairman, and good morning to all the members in the Ministry of Education. I have a couple questions and concerns, and I would just dive straight into those. In your information submission to us, we asked the ministry to respond on the over a 3-year period for statistics on students diagnosed with substance abuse. However, in the submissions, you indicated they are users of marijuana, alcohol, and cigarettes. So there were really no information on substance abuse. My question is, has there been an increase in the number of students who are users of the mentioned substances, marijuana, alcohol, and cigarettes during the period under review? Members of the Education Ministry?
Through the chair, I would like to ask Ms. Natalie Robinson-Arnold to respond.
Please go ahead, please.
Pleasant good morning, everyone. We were unable to ascertain because during the last 2 years, our children operated online learning and at home. So a lot of those information would not disclose to the Ministry of Education. A lot of our substance abusers, we find out when they are actually at physical school and they engage in the activity. At home and within their communities, harder to get that data.
All right, and in the process, I would like to know, are principals of primary and secondary schools obligated to submit reports to the ministry on students found using drugs on the school compound? Are those instances reported to you all at the ministry?
Ministry of Ed.
Mr. Chairman, in terms of reporting of instances of alcohol and drug abuse, those instances will come through from the various principals to the district offices. In terms of the actual compilation of that data, I am unable to say whether that is compiled anywhere. We are working on systems to have data collection done virtually, but that is sometime off in completion. But if we, the schools would pass that information up through to the school supervisors and to head office through that portal.
Okay. Moving on, I would like, in your submissions, you all indicated that, unfortunately, and very sadly, we've lost 63 students at the secondary school level, 22 students at the primary school level who were clinically diagnosed as being depressed. in terms of the depression over the last 3 years, you all further went on to indicate 9 secondary schools have been reported as committing 9 secondary students that have been reported as committing suicide over the last 3 years. My question, have we delved or investigated and came up with some of the reasons and or concerns from these cases, the statistics that unfortunately made its way into the report? Did we look at these families and try to ascertain what were some of the causes so that these things will never happen again? And what are some of the steps the ministry is doing to prevent same from happening?
Through the chair, Ms. Arnold.
Yes, thank you very much, CEO. So the ministry has engaged in a lot of assessments with our students that were identified as having challenges. We have collaborated heavily with the Ministry of Health in assisting us in running some programs for our identified students and depression. We have what is called standard operating procedure for our children who have mental health issues, in which the first line of intervention comes from the Ministry of Health. In the interim, while this is happening, what happens to our children is, after the assessment, we develop what is known as a treatment plan for our children. We are engaged them in individual counseling in collaboration with their parents. We also do teacher information session, so the teachers could be our first responders in the classroom so that they could identify if there are any changes or anything that may challenge our students. So we give them the skill set to help identify those students. During the pandemic, what happened is we had, besides individual counseling, we had support groups for our children who would have had mental health issues, even those that identify that may have challenges that can, for psychoeducational purposes. So those were some of the programs that we did with respect to mental health in supporting our children during COVID-19, as well as the hotline that was available for our students, our parents, that they can call 24 hours so that we can support our students as best as we can.
Ms. Robinson, you will give us information about what types of situations would have prompted that the Ministry of Education through the Student Support Services Division would have been able to ascertain what the primary causes of the students calling the SSD hotline during the pandemic. What were their primary issues?
The primary issues really were devices. Some of them, they had challenges with devices. For our children, we got more calls from our parents who felt that their children were a little more depressed. They weren't behaving the same because of the change. The calls came heavily mainly from concerned parents and teachers. The social engagement changed, and that created a change in their students' behavior, as well as a lot of developmental issues occurred at that time.
So the disconnection from their peers, you mentioned devices, the disconnection from their peers and their inability to access, I guess, their education was a primary concern to them.
Most definitely.
Okay, Member Singh, go ahead, please.
Emotional well-being.
Thank you, Chair. If this is even reported, that parents themselves call into these call centers for support, and the issues really deal with the parents not being able to deal with some of the challenged students for various reasons. What happens in a case so that those looking on and those hearing could find out what are some of the alternative measures that parents can utilize if they are unable to cope when they realize something is going wrong in their children's lives, and even make the call for support and the parents cannot really deal with the matter themselves. What could parents out there do to be able to, bring relief to situations?
So normally they can use through their school or they can call in. We have our parenting and education program with our parents the skill set and how to understand some of the social challenges or the mental health challenges that their children may be experiencing. We give them coping mechanisms. Sometimes parents themselves experience that. So we look within the family and as the chair said, the root causes that will have created that challenge within the family. And we have support them. If there is need for further intervention and specialized intervention, we have our clinical psychologists and school psychologists in which they intervene, as well as we have our external providers and our more specialized intervention from the Ministry of Health. So we do networking, we do the referral that is necessary. If it's a financial issue, we refer to the Ministry of Social Development. So we do that networking so that we could best meet the needs. When our parents are in distress, our children will also be in distress. So we try to minimize as much as possible with the parent population.
Thank you. In looking at some of these statistics as well, I see that more female students than male students were diagnosed with clinical depression between the years 2020 and 2021. In particular, what specific interventions have the Student Support Services Division provided to sensitize, especially our young girls at school, about depression and assist students to cope with or manage this depression? Because I see these statistics favor, more female students tend to have these problems.
So during the pandemic, we had a lot of group sessions happening at per school level because each school varies and community. Plus, we had national support group on emotional intelligence, grief and loss, and how to coping and resiliency, as well as stress management for our girls. And our girls will participate in those programs more, as well as our DIU unit, which Ms. Bailey Rez is here, had a mental health program attached which involved all the disciplines within student support services to address the mental health of our students during the time.
Okay. And I know in terms of dealing with these issues at school, persons and professionals attached to the Student Support Services Division, they are very critical at this point. But I'm seeing that there are currently a vacancy, 328 vacancies across the units. Are the numbers sufficient, the current establishment and the current bodies you all have, are these numbers sufficient to manage the current workload of the units?
Ministry of Education.
Hello. Right. Yes. So
why does this question elicit a smile from everybody?
Almost silence, Chairman.
Silence and a smile, a very telling smile. Mrs. Henry David, go ahead, please.
Yes, Mr. Chairman. As Mr. Singh would have indicated, we have a number of vacancies. Clearly, we do not have the staffing that we would like to have. However, the staff that is currently attached to the ministry tries their level best in terms of the programs, in terms of sharing resources, in terms of doing
Ms. Henry David, yes. With the greatest of respect, what is your staff complement now? Student Support Services.
It is
ballpark.
Off the top of my head, I can't see. The different disciplines would have to answer. Natalie, can you indicate for social work? Okay, so based on the figures that we provided, we have in terms of guidance and counseling, we have 236 members.
How many, sorry?
236.
Mm-hmm.
In terms of social work, we have 127. In terms of psychologists, we have 24. And in terms of special education, I'd have to do some tallying there. Right, so I would have to provide you with that figure, Chair, because I'll have to do some tallying. It's about
so it's about
300 plus.
300 plus.
Yes.
So you're almost 50% short of your workforce complement. Would that be a general assessment that's accurate?
Yeah, pretty much.
Ballpark. So I'm trying to figure out, given the increased load during the pandemic, based on the question member Singh asked, how are you even completing a modicum of effective interventions?
Mr. Chair, because of our concern for our children, we try our best. This is what I can say to you at this point.
I'm not questioning your commitment.
Yeah. Don't throw our hands up in the air. We continue to work with what we have. We concentrate our services on the most vulnerable. We provide generalized services at the individual class level. So they will develop programs, and the fact that we have been in the pandemic and we have now moved a lot of services online, it gives us the opportunity, for example, to provide videos, video sessions, and so on, recorded sessions for our children, which can be administered. And we use everyone in the system so that the teachers are the first point of contact with our children, and they would be able to do referrals where necessary. They would be able to alert the personnel at the district level as to where or which children are in most need, and so that we'll be able to target.
While I agree with the question of the statement was not meant in any way to impugn your commitment, you are clearly a very committed group. But in terms of any organizational structure, if you are down by half of your human resource, you cannot operate effectively.
But Chairman, if I may, then the question should be, has there been any outreach by this committed group, as you said, and I'm sure that there are, has there been any outreach to the government or the necessary agency to have those numbers increased? Very simple.
Mr. Chair, we have, I know that in one case, in terms of bringing persons back on, we had one note. We are also working with OJT, for example, to increase the number of aids, student aids for the children who need individualized care and attention. And we continue to work within the parameters. I know that we have on occasions advertised for specific positions that may have become vacant, and our HR continues to work.
You know, I want to make a point, make something very clear here. As we say at the start of every JSC, we are not trying to engage in a blame game. We are here trying to find answers and quite frankly, advocating for the resources you need through these media. We believe when we bring the issue to the public attention, there may be more advocacy for people for the appropriate agency to supply the needs that you have, because clearly I can see the commitment, and I've seen over the years, because this is not the first time the Ministry of Education has come before us and the student support services. And I have regular interface with persons working in student support services who are extremely committed and hardworking, because at the end of the day, it's about the nation's children. But certainly the advocacy must continue to fill these vacancies, because having this many vacancies in a situation where the load is continuously increasing for this division, I sometimes say a prayer for student support services, because your workload is increasing all the time. The demand on your staff is increasing all the time exponentially. So if there is not some improvement in the mechanism through which you are getting these vacancies filled, it is going to continue to put a strain on the employees who are there, just like we saw with the healthcare workers during the height of the pandemic, and it is going to affect their affect their ability to effectively intervene. And that's why we are here to find as fact-finding mechanisms to get some sort of intervention, that you get the resources you need. This is not about blaming the ministry or the ministry officials who are, and I just want to make that very clear. This is about really trying to get to the root of the issue and finding mechanisms for solutions. Member Singh, you can continue, please.
Thank you, Mr. Chairman. And I will close with stemming from Member Naked and your own submissions, Chairman, the importance and, like I said, the statistics, the sad statistics that we have lost 9 secondary students in the last 3 years. And if this is not critical enough for whatever mechanism is to be employed to have these vacancies filled, to at least give students the fighting chance, I want to indicate that we really need to do better in terms of getting service commission, teaching service commission, and by extension, all the service commissions to understand one child loss is too much, and we need to do everything in our authority and our power to ensure that we don't blame the death of a child due to suicide to being short-staffed or having no personnel in terms of certain schools and certain districts. So it's just to end with that comment, Mr. Chairman, and to thank the members. I mean, very committed. But as a fact-finding mission, and it's really not to, put anybody in his spot, but it's to understand what's going on so that we could make the representation to ensure that our students have that fighting chance. Thank you, Mr. Chairman. Thank you to the Ministry of Education.
Thank you. And I know the intervention on my part is because I saw the body language of Ms. Henry David. I know sometimes it gets frustrating for you to come here and answer the questions because it seems like all the questions are coming to you, but I mean, sometimes you're the only interface we have. I have a question for the Ministry of Education, Student Support Services, and the Ministry of Education in general. One of the issues globally that leads to teenage suicide and sometimes precipitates substance abuse is the issue of bullying. And in this new paradigm, online bullying. Is that one of the issues that your clients are telling you is on the increase in Trinidad and Tobago, and sometimes they contributed to their depression?
Ms. Robinson-Arnold, through the chair.
Because of the virtual sphere in which our students exist during the COVID pandemic, the cyberbullying was easier to identify at that time because they weren't in physical school. So that is the only form of bullying we were able to identify during the COVID pandemic.
So could you repeat that, please? Sorry.
Oh, what I was saying is that because of the virtual sphere in which our students were engaged in the past 2 years, cyberbullying was the only form of bullying we were able to identify. We held our usual program using the RTI model, the universal, targeted, and the specialized model where our guidance officer will work with our students in the classroom doing universal work, and then it will be referred to a social worker who will do the more targeted small group intervention. And if our students continue to exhibit those behaviors, our DI, our psychologists intervene for specialized intervention, with a specialized intervention.
But has there been an increase in that because, of course, they're all online, or they were all online primarily?
Yes, because that was the only way to identify the bullying.
Mm-hmm. Okay, thank you very much. We're going to go now to the Ministry of Social Development and Family Services. Member Mohit had to leave us. I think she has to attend the sitting of the House later on. So Member Naked and I will share the duties in terms of the interface with this group. My first question is, based on the discussion with the Ministry of Health earlier on and prompted by Member Naked's question, can the Ministry of Social Development and Family Services indicate what sort of outreach has been done during the pandemic, given the challenges that are faced by some families in some communities, in the context of their own circumstances and its impact on their mental health and well-being.
Hi, through the chair, I'll ask our Director of Family Services, Ms. Saka.
Yes, go ahead, please. Thank you.
Yes, good evening again, Chair. We have had a number of outreach programs, starting with our PIES, which is the Public Information and Education Series, where we would have gone into, we would engage different agencies and support groups, alerting them to the services that the ministry offers. We would also have done our radio and our television programs, Let's Talk Family Time, and Time Let's Talk, where we would also provide information to the general public about certain specific issues related to family and family challenges. We've also, over the past year, launched what we call our Family Fridays on our Facebook page and our social media pages, where we give tips on issues related to the family, including mental health, including substance abuse, in an effort to sensitize and educate the public as to what's going on. Now, you would understand that we were not able to actually go into these communities as a result of COVID. However, we continue to try and reach out to our community liaisons and just to keep them involved and make sure the persons know that the services of National Family, what the services are, and how we can access it. So that has been our outreach program. We are now moving out into the communities. We will be starting a process of moving into the communities now that we are able to do that level of outreach.
Now, what were the mechanisms for outreach? You used the telephone, I'm guessing, during the pandemic. And I know the ministry had been heavily involved in processing applications and grants. During the processing of those applications and grants, was it used as an opportunity to gather information on the circumstances of those families and individuals who were accessing the grants, also to see what their general circumstance was, which would have led to their needing to access the grants in the first place before the pandemic or during the pandemic or precipitated by the pandemic?
At the point in time, in terms of the processing of the grants, Chair, we were heavily involved in just processing the grants. Because of the quantum of the grants that we received, the applications, our aim was just to get the grants out there as soon as possible to the families in need, because their circumstance would have indicated they needed the particular help in terms of the food and so on, where we provided food as well. So the economic help is what we had concentrated on at that point in time.
Member Naked?
Yes, Chair. Just to piggyback a bit on what the Chair asked, do you have any data, given the specific regions that you spoke about, Ms. Saka, I think, who spoke previously? Do you have specific areas where you saw an increase in the need for those kind of support services that you mentioned? For example, as I like to be specific, especially along the east-west corridors, those disadvantaged communities, do you have any data, for example, for Mobile, Lavantil, Barataria, Mongdo, those areas? Do you have any specific data?
Yes.
And that's a follow-up question to what the Chair just said. Because if you do, then maybe some data was collected regarding their mental health situation. Sorry, please go on.
Yes. Yes, we do have that information and it can be provided to you. We would have separated our information, our data, in terms of suicide, ideation, family life issues, marital problems, mental health issues, behavioral issues, life crises, parenting, domestic violence, financial issues, abuse, incest, depression. So we do have information in terms of specific areas. I will just call a few in the north, ones that you would have asked about, Belmont, St. George West, Sealots, Morva, and Central, we would have at least just a few. In Central, we have information on Couva, Freeport, Paxton Bay, Charlieville, Londonville. In South, we would have looked at Fanny Village, South Oropouche, Barracoa, Gasparillo, San Fernando, and La Romaine. In the East, Sawa, Santa Cruz, Barataria, Purep, Tunapuna, Arima, Aruca, to name a few. So we do have some information, some statistics available on.
And just for clarity, that information is on persons who access the grants, or persons or families and persons that you would have, through your interface with them, been able to realize there were some mental health issues that could have been present.
Yes, these are just specific to our National Family Services Division. And we would have received over, we would have possibly have received referrals from social welfare, which would have formed part of this information that I have here.
This is excellent. So now, given that you have that data, can you also give me the data that how you followed up, that you recognize what were the problems at hand? How did you assist those same families?
Okay, so once the initial call came in, we would have assigned them to a social worker depending on the area, and the social worker would then have been responsible for following up, setting up a case plan, or doing the necessary referrals going forward.
I understand that, Mrs. Saka, but what I'm saying is that since you have the data about the families affected in those disadvantaged areas that you mentioned, then you will have the data about how you assisted those families specifically, no?
Yes, we do. We would have that information based on the counseling, numbers of persons that would have been counseled, number of persons that would have been referred, number of persons that would have been given advice, and persons that would have, how we would have actually dealt with the issue depending on the situation.
So, Chair, can I be a bit forward in asking through you that we get that data to the committee? Chair?
Absolutely. I was going to ask if the acting, let me just get it right here, the permanent secretary, or through the permanent secretary, if we can get the data that she would have identified earlier on in terms of the areas she outlined. Sorry, not she. Miss Borrell, is it Reyes Borrell?
Okay, it's Ms. Saka.
Yes, if Ms. Sanko could give us the Assistant Director, Family Services. If we could get information identified earlier on of those areas where intervention was sought, and also, and as a related question to the Permanent Secretary, Ms. Cicharan, you indicated that you consumed, maybe an appropriate word, with actually processing grants. Now, those grants would have had to have an address attached to them, I'm presuming, right?
Yes, they would, Chair.
So which means you actually have data on the areas that those persons were registered in or registered with you in, to give us a sense of what areas in the country would have accessed the grants most. No? Or yes?
Yes, Chair, we do have the data. What we'll have to do is to compile it and we will submit that.
That would be appreciated, so we can get a sense of where the greatest demands came from in the country, so where it may be an indication of where the greatest needs are generally that can possibly be superimposed on the information that Ms. Sanka just gave us as to where the psychosocial intervention requests came from, to see if there are correlations in those data sets. Member Naked, go ahead, please.
All right, I'd like to move to the issue that the chair and I mentioned briefly before, as regards to street dwellers. I see it mentioned here as street dwellers that we know as homeless, the homeless that inhabit the nation. the first question, before I ask you about the mental challenges that they face and what arrangements that you had put in place to support this specific group during this COVID-19 pandemic. Do we have any accurate data about how many, as you put it, street dwellers we have in the country?
Through the chair, I'll ask our Director of Social Displacement Unit, Ms. Reyes Burrell, to respond.
Good day, Chair. What the unit would normally do, at least annually, is to conduct a head count on the streets of Trinidad. And it's usually done within the areas where city population, city and towns, and that is what we use in terms of to use as our data on persons living on the streets. Also included when we do those counts will be the number of persons who are in the two shelters in Port of Spain, the one shelter in Port of Spain and the other shelter in San Fernando. So that data is something that we collect to determine the number of persons who are found.
Do you have that number with you now?
What our latest count would have been March 2020, and we expect that we were doing we did not do a count in 2021 again because of COVID concerns. This count is done with persons being in one vehicle driving around the city, so that was not something that was advisable. So we do have the data for 2020.
Could you share that with us, please?
Yes, we can.
Or you don't have it on you now?
No, I don't have that number in now.
What is the classification for, because I'm presuming in some cases you actually, do you talk to the people who you suspect are displaced and on the streets, or is it a classification criteria that you use to count that person as a socially displaced person?
Yes, it is a classification criteria because a head count that's done in the night, we use the head count is conducted between 11 o'clock in the night to 5 o'clock in the morning. So it is persons found sleeping or in the streets at that time who look a particular way in terms of, and in some cases, we do know who they are, especially in the Port of Spain area. So that is what.
Can I give you some anecdotal evidence? 3 years ago, I did a media project where I was doing a series on socially displaced persons. So I drove around Trinidad. I didn't go to Tobago for 3 months, filming and in some cases interfacing with persons who, as you say, seemed to be indigent, seemed to be on the street. And I, solo mio, got up to 435. Between Port of Spain, the East-West Corridor, Central Trinidad, San Fernando, and areas in Deep South. And that is anecdotally because I was just driving around doing the project. And I did not go into the shelter in Port of Spain, which I refuse to call a shelter because it is a car park and should not be housing human beings, my opinion. And I did not count those people in there. So I'm waiting the data that you have. Yes, Member Nakid.
That is our opinion shared. That should not be housing human beings, and it's an opinion shared by myself as well. Which brings me to the point. The chair mentioned the figure of 435, I believe, Chair?
Yes.
Okay, just to let the committee know that your data reaches 2020. The obvious question is, you said that it involves a single vehicle. Did I hear you correctly? Of somebody driving around in a single vehicle to count the heads of those who are socially displaced? Did I hear you correctly? Hello?
Yes, we use a vehicle driving around counting.
You use a vehicle. You use a vehicle.
Pardon?
Sorry? Okay, sorry.
Yeah, we drive around in a vehicle. In some of the areas, we're escorted by police.
Well, the obvious question, given that it's 2022, is that the most effective way to find out where the street dwellers, how many street dwellers, as you've noted, how many street dwellers we have in the country? Because I'll tell you what, I have fed, anecdotally as well, but very accurately, I have fed close to, right now in Port of Spain and the environment, at least 600 to 700 socially displaced people. I haven't reached the South Central like the chair did. I'm talking about Port of Spain and the environment. Now, maybe you don't know, but the online minister also came in the parliament. I don't know if the chair remembers this, and stated that there were 422 socially displaced people in the complete area of Trinidad and Tobago. I remember that very, very well. I disputed those numbers then, I dispute it now because I work on the ground. The chair just mentioned his work on the ground and his numbers. I don't think we are even close to recognizing, which brings me to the point and to the question. What special arrangements that your ministry put in place to find out among these street dwellers, as you put it, I prefer socially displaced? How many of those people had your support of your group to find out who were mentally ill, and how many of those that you could address appropriately? Any idea?
Well, let me just add to that, Member Naked, in terms of the question you're asking. Can the ministry officials tell us, because we were just told that the mechanism for identification is primarily visual, where persons who are identified as being in the streets between 11 p.m. and I think it's 5 or 6 a.m. you said, were identified as someone who is socially displaced. And in addition to how they looked, was there any interface with that person? Because I know there's a legal challenge with actually dealing with the people, which has been one of the challenges we have generally in the country. How do we know, what is the mechanism for finding out if that person has a substance abuse problem and or a mental issue that has precipitated them being on the street?
Chair, let me respond initially, and then Ms. Resborough could probably add. In terms of the street count, remember we are just going around looking at persons and counting, so there is no interactions with the persons as such. And for those persons that are on the street between that hour, that hour of the night, they are like sleeping on the pavement or so on. So there's no interaction with them to determine whether they suffer from substance abuse or mental issues. However, for the persons who are housed at CSDP, we do have records of those. So there are portions there are a number of them who are mentally challenged, and most of those persons are outpatients from St. Anne's, from Ward 1. And they have nowhere to go, so they are housed there. We also have persons with substance abuse there that we are aware of. And there are other persons who we are trying to take under our community care program right now. We're trying to place them because they are like 55 and over, and they just have nowhere to go. So we are looking at the population within the CSDP right now to see what we can do to further assist them and not just leave them there. As you said, I agree with you. It's not suitable living accommodation.
Well, in addition to that, and this is not aimed at you, it's not suitable rehabilitation conditions, which is an added issue in that particular situation, but I know that's beyond your pay grade. Manaka, we're running close to 12:50 now. Do you have any other questions to the Ministry of Social Development or any of the groups before us? And Member Singh? Member Singh, any questions?
I do have a question.
Not at this time, Chair. I'm good.
Okay, I have a final question for the Ministry of Social Development and Family Services. Are there plans, because I know we're coming out of this pandemic, thank God, to, given what we've discussed here in the context of this inquiry, the inquiry objectives of looking at substance abuse and or mental health care issues. Is the Ministry of Social Development and Family Services looking at doing some sort of national scan? I know the Ministry of Planning has, if my memory serves me correct, identified a national census coming up. Have you had collaboration with the Ministry of Planning on that census to dovetail a possible scan of the population in terms of looking at the economic circumstances and or substance abuse and mental health issues that prevail in the country in that scan? Or are you doing one on your own? Or are there plans to initiate that type of national scan on your own?
Chair, I'm not aware of that, but that is a good suggestion that we will take into account.
Which one, to do your own scan or to dovetail with the Ministry of Planning?
To dovetail with the Ministry of Planning.
Okay, it confuses me as to
resources we are talking about there.
It always, and this is not aimed at you, it always confuses me that people have to come to these JSCs to get these grand ideas when it seems like ministries should be working together. Anyway, that's not in your board. Any other questions, Member Nakin and Member Singh, before we go to our stakeholders to start to wrap up?
Yes, I have one last question. Because we are talking about it and about the socially displaced. But I would like someone in the ministry there to give the public the idea so they can fit it in where it should fit. What is the budget at the ministry to deal with the socially displaced?
Ms. Rez-Borrell, can you provide that data?
I would not have a budget for the socially displaced, given that, one, the persons who are living on the streets, they are beneficiaries of a number of services and grants from the ministry. There is also the support that is provided to NGOs for their services that they provide to persons living on the streets. So there are budgetary allocations in different parts of the ministry that would cater for this category of persons living on the streets. The social displacement unit, we do not have a specific allocation in the budget in terms of programs. Many of our programs are delivered through the other programs of the ministry.
Well, can I respectfully make a suggestion that kind of, I would suggest maybe that plan that you just said that takes place, that seems to overlap and people could get lost, because in the end we are dealing with people. Wouldn't it be better to have a specific budget, given the numbers that we have now, pre and post COVID-19, to have a specific budget to deal with the socially displaced? Wouldn't that be better? So then we probably wouldn't have a vehicle driving around between 11 and 5 counting how many we have. Maybe something better to be in place.
Let me give a little clarity in terms of that's a head count that's done in the night. We also have field officers of the unit that are on the streets, so during the day, they do that interface that you're speaking of in terms of being able to get a sense of talking with the clients and get what their needs are. On the streets, there can't be a formal determination as to what a person's challenge is, because you're on the streets and you're dependent on verbal information and what you see the person as. That needs to be done under particular conditions, and those conditions should be within a place that's what we refer to it as assessment center. So it is not just that head count, and that's a head count that's done in the night, is done to determine the outside figure, who we find sleeping in the night and who are also in our shelter. So that gives us our outside figure. Yes, persons on the streets, and yes, I have heard anywhere between 600 to 700 persons being provided with meals in Port of Spain, and That I respectfully submit. This includes persons who are also experiencing levels of poverty. They may not be street dwellers, but that is one of the ways that they access their meals. That if you were to seek to determine if they're living on the streets, they're not living on the streets. They are living, they have some sort of living accommodation. So in terms though of the budgetary question, the fact is the NGOs that are delivering services to street dwellers, there's a specific allocation that NGOs can access to provide their services specifically to the street dwelling population. So I disagree that the population would get lost under that kind of arrangement. And because again, the services, while it may not be to say that it's a service, the funding for the NGOs is specific to the service to street dwellers, but if persons who may be experiencing street dwelling can access any one of our other grants, including counseling, including financial accommodation, assuming that they're not in one of the shelters, that's legitimate. That's good. As far as I'm concerned, they are receiving help based on the fact that they have a need. So I don't think they're getting lost. I do know that there are challenges to responding completely to this issue of persons living on the streets. And it is something that we continue to find ways to do and meet needs as best as we can. So for example, during the pandemic, we did open a shelter specifically to house the persons living on the streets, given the fact that they would have had challenges. Because when you live in the streets, if you get your survival from persons being in the road, if persons are not on the road when all our various shops and were closed and employment, our government services were closed, in terms of not so many people be out on the road, the street dweller had less opportunity for their meals, less opportunity for all persons who usually just hand them things. So there was a specific shelter that was opened to be able to meet the needs of the street dwelling population in Port of Spain. So
I appreciate the very detailed answer, but can you give me at least a figure of what you supply to the NGO or to the other entities that you outsource this care of the socially displaced? Can you give me a figure so that we can place it in some context?
I'm sure that can be provided, yes. It's through our subvention mechanisms.
So we'll ask you to supply in writing, please.
Yes.
All right, and also from the Ministry of Social Development and Family Services, if you could give us a breakdown of the information that you don't have on you that we would have discussed earlier on, we'd greatly appreciate that. Finally, before we wrap up, just for my own curiosity, because I think many of us share the view about I don't know what it's called, the car park that houses socially displaced persons. What is the mindset with that? And is there a schedule for maintenance, a schedule for interface of those who are housed there to make sure that they're all right, so that intervention services are supplied to them? I think one of the officials indicated earlier on that many people who are outpatients of St. Anne's institution go there because they have no place to go. What is the ministry's general interface with that car park? Because it's a car park.
Okay, Chair, what happened is that we do pay an NGO to manage that facility, and part of the payment refers or is in relation to social services. They have to provide social support and intervention for the persons, the residents at that facility. We are looking at, as I said, assessing the different categories of persons there and relocating them. So some of those persons, as I said, we're looking to put them under community care, that is homes for the aged, which we will pay for. We are looking at, recently this week, I had a meeting with officials from the Ministry of Health in terms of the persons who are mentally challenged, the mental issues, as well as the substance abuse. So we are working to relocate those persons. Our intention is not to leave them there.
And there's a timeline attached to that?
Well, we are hoping to do it before the end of the year. to have that area closed. Yes, that's what we are looking at.
And I will tell you that I know a family who had someone who had substance abuse issues who was housed there, and I don't know if it's something that happens often, but the person died there because they weren't getting any care, and the family identified the body, and it was a really tragic situation because the standard of care that the person could not get in that institution may have been a contributing factor to their eventual demise. Just quickly before we go, we didn't get a chance to touch on, this is to the Ministry of Social Development and Family Services, in terms of the elderly care homes in Trinidad Tobago, and whatever information you have regarding how persons in those elderly care communities who were primarily elderly people who were more susceptible to COVID fared in terms of their mental health situation. Do you have any information regarding that? Did you interface with those elderly care homes or the association that governs those homes? I think it's Ms. Ruiz is the president of the association regarding gathering data on that vulnerable group.
Chair, we have not done that, but we would look into that. It's just that during the COVID, restrictions, those homes were restricted in terms of persons visiting. Even our staff, they were limited in terms of, because we feared for those older persons
But the Division of Aging didn't make calls to actually just find out how everything was going, even if they couldn't visit?
But they did make calls in terms of to verify that the persons were okay and to verify their life, because we have to pay homes based on the persons being there.
All right, thank you. We're running out of time now.
I know we are out of time, but I just one very important question before I leave. You mentioned that you pay an NGO, if I'm correct. You mentioned you pay an NGO to deal with that, the car park / shelter for the socially displaced. Can I have the name of that NGO and the budget given to them to do so, please?
Sure. Can we provide it in writing or?
Yeah,
please do.
If you can now, it will be good. Well, because we are in a public forum, I guess for the public would be best.
Okay, well, it's the St. Vincent de Paul. Society of St. Vincent de Paul, we do pay. And the budget, I believe, is over 2 million.
Annually?
Sorry, I don't want to call a wrong figure now, but I'll provide the budget to you.
Well, you already did,
In writing.
So it's going to be in the newspaper tomorrow. So please confirm it in writing.
Yes, I'll do that.
And if it's an annual subvention, and if it's specifically for the management of that location.
Yes, it is for the management of that location.
Oh, thank you very much. Thank you. Okay. Thank you, Member Nakin and Member Singh, and the other members who had to leave us earlier. At this point, I'd like to ask Deputy PS Noel from the Ministry of Affairs to give us your closing comments, please.
Thank you, Mr. Chairman. Mr. Chairman, members of the committee and colleagues, thank you for your questions and feedback. Our team at the Ministry of Health will continue to work towards the ongoing enhancement of the programs and services for mental health care during the COVID-19 pandemic, future emergencies and beyond. We thank you for your feedback and your recommendations, which we will take note of. Thank you.
Thank you so much. And Mrs. Henry David, Acting Chief Education Officer, Ministry of Education.
Mr. Chairman, thank you very much. The Ministry of Education is heartened by the concern of the committee members for our children and by extension the staffing levels at the ministry. I assure you that we are taking steps, however slowly, to have the positions filled. We will continue to do so, and we will continue with the limited staff to provide services to our children and to collaborate with our fellow ministries and other stakeholders in order to provide services needed by all of our children. Thank you for the opportunity.
And next, we invite the acting PS, Ms. Sicharan, Ministry of Social Development and Family Services.
Thank you, Chair. I want to take the opportunity on behalf of the ministry to thank yourself, colleagues from the other ministries for the rich discussions we had this morning. We do take into account the recommendations, and I thank you for our ability to share with you some of the initiatives that we are presently undertaking in the ministry. Thank you.
Thank you all so much. This brings to an end this inquiry. We are happy to have had you with us. Thank you all for those of you who have interfaced with the Parliament, ParlView and social media channels. On behalf of the other members of the committee and those who were with us, the Secretariat, who of course continue to provide human service, and the committee's chairman, Paul Richards, thank you for viewing, and this inquiry is now adjourned.